Hi, Dr. Yass here. I want to talk about the opioid crisis that is existing at this time and try to put some sense to the understanding as to why this opioid crisis even exists. There seems to be this sense throughout the culture and even the government and the media that the opioid crisis exists because of the fact that opioids became accessible, and as a result, it is now supplanting street heroin as the primary means of use casually for people to get high. This just has no basis of understanding and really doesn't seem to take into account the timing of when opioids became so overused in comparison to when, let's say, casual use of heroin was at its highest. So if the answer to the reason that opioids are being so overused now and produced at such high levels is because there is an attempt to replace heroin with casual use of now opioids, my question to people would be, well then, why wasn't the production of these opioids, fentanyl, OxyContin, Vicodin, produced at the time when heroin use was at its height in casual usage, which was the 60s? If the answer to the fact that opioids are being used and produced at such high levels is because there's such a demand casually for it, why wasn't this produced in the 60s when the height of heroin use was at its height? It couldn't have gotten any higher. And if the idea of replacing heroin with opioids was the answer, that would have been the time to produce this massive amount of opioid. Clearly, that didn't happen. When did the heightened production of opioids develop? It was clearly in the very, very late 80s, early 90s. What had developed at the same time? The chronic pain epidemic. In the very early 1980s, the MRI started to be used to identify the cause of pain. It found structural variations such as herniated disc, stenosis, arthritis, pinched nerves, meniscal tears, compression fractures, and similar type of structural variations. And because the person was having pain or other symptoms at the time the MRI was produced and the structural variation identified, the assertion was made that the structural variation is causing the symptom. And treatment followed relating to those structural variations. Now, if we just take a moment and understand the idea of pain, this will help us understand why chronic pain exists. Pain is basically the body's emergency distress signal designed to create conscious awareness that a tissue is not functioning properly. That tissue, the tissue in distress, elicits the symptom to try to make the person aware of the distress of that tissue so an intervention can be performed to resolve the distress of the tissue. Upon resolving the distress of the tissue, that tissue no longer has to release the emergency distress signal and pain ceases. Let's all acknowledge that the initiation of the symptoms, including pain, occur at the initiation of the distress of the tissue. So pain or other symptoms are acute in nature. They develop at the time the distress of the tissue begins. So if the proper tissue is identified through the appropriate diagnostic model, and an intervention is performed to resolve the distress of that tissue, then by definition, the symptoms should simply cease, and acute pain should never go beyond acute and certainly should never become chronic. If you understand that as the very basic core principles of pain, you'll recognize that chronic pain should not exist. Now, when the MRI started finding structural variations and asserting simply because they were found at the time that pain or other symptoms were occurring, that was the cause, is baseless. The most obvious indicator of that is if you had taken an MRI a year or several years prior to the symptoms existing, the MRI result would be identical to when the symptoms existed, because these structural variations take years, if not decades, to develop. But you see, nobody came to think about the timing of the MRI. This simple assertion that just because it's found, the symptom or the structural variation is found at the time the symptom is occurring, that somehow that means that the structural variation is causing the symptom, is just a meaningless statement. It's called correlative theory. The best way to understand correlative theory is if I go to my front door, and just as the sun rises, I open the door and I continue to do that over the next 6 months, I guess I can say that I have the power over the sun because I can cause the sun to rise by opening my front door. You could clearly see I open the front door and the sun rises. So there's the correlation. I found the structural variation at the time you have pain. Okay, then that means it's causing pain. But it's simply not. It's simply not true. The structural variation existed well before the pain existed. And if we take the alternative position to herniated discs or structural variations cause pain, then that is to say those without pain should not have structural variations. And infinite numbers of studies have already shown that as many people with no pain have the same level of structural variations as those with pain. I'll say it again. As many people with no pain can be found to have the same level of structural variation as those with pain. It is clearly an independent variable, structural variations in pain. So, you can see that by diagnosing the improper tissue and continuing to treat it will lead to chronic pain. Once the medical system acknowledges that they are incapable of identifying the proper cause of the symptom, the tissue in distress, they really have very limited alternatives other than to try to help the person by masking the symptoms. If we try to mask the symptoms, we don't address a cause any longer. We're simply going to try to work within the brain and try to find ways to minimize its awareness of the pain signal that's being elicited from the tissue in distress. Remember, the pain receptor is in the connective tissue that surrounds the tissue that's in distress. That pain signal is sent from the pain receptor up to the brain to create conscious awareness. So that pain signal is still being sent to the brain. The purpose of opioids is to mask the brain's acknowledgement of the pain signal. So what you really see here is that chronic pain due to misdiagnosis of the tissue in distress, and you can't see it any other way, then chronic pain has to occur by misdiagnosis, or else acute pain would resolve in the acute stage. So chronic pain exists 100% as a result of misdiagnosis. Once the chronic pain is sustained, there's no alternative for the medical system than to try to mask the brain's awareness of the symptoms. Basically, once you are prescribed pain medication or cortisone shots or epidural nerve blocks or radiofrequency ablations, which are cauterizing nerves, that is the medical system's basic raising of the white flag saying, we give. We no longer have the capacity to identify what tissue's in distress, so we have no alternative but to work on mechanisms to mask symptoms. So when we talk about this opioid crisis, obviously a very, very, very small percentage of those who become addicted are teenagers or individuals who have access to high levels of opioid medication that they were not prescribed for them. They are typically for the parent, and the teenager or young adult has the capacity to get to that drug. But if the parent had their pain resolved in the acute stage, chronic pain would not exist, and the parent would not have been prescribed the opioid. So even in the case where the individual who's becoming addicted is not the individual who the prescription medication was prescribed for, the access to that medication was still gotten by somebody who wouldn't have needed it if their pain was resolved in the acute phase. There's really no way of logically looking at the opioid crisis without saying it is directly connected to the chronic pain epidemic. It just has to be perceived that way. I recently saw that there was some study that was done, and they're trying to find ways to minimize how much opioid is prescribed to people, and it had to do with someone, I believe, getting a gallbladder operation, and after it, how much medication is being prescribed to that individual, and if you simply give them less, they take less. I'm pretty confident in saying that the average person who's suffering from chronic pain is not suffering from chronic pain after a gallbladder operation. This shows you the complete lack of magnitude of the situation that the medical system is able to grasp, or they just want to walk around the edges because they're unwilling to acknowledge that the opioid crisis is actually a crisis created by them. But the reality is that in the majority of cases, the reason people are taking opioids is because the cause of their pain is being misdiagnosed. That is the only way acute pain can become chronic. Now, if you want to stop the opioid crisis, come up with a better mechanism for diagnosing the cause of pain. What is that mechanism? The Yass method. The method that interprets the body's presentation of symptoms to help understand which tissue is in distress, eliciting those symptoms. If you could identify the tissue in distress through the symptoms, you can quickly resolve the distress of that tissue. Acute pain is ended, never becomes chronic. In 95 to 98% of cases, the tissue in distress is muscle. That's the part that basically befuddles the medical system, because muscular causes can never show up on diagnostic tests, nor is there any medical specialty educated or trained to identify muscular causes. I get calls every day. This has been going on for 25 years, and everyone's call is the same. I have pain, I seek medical attention, I get an MRI, find a structural variation, get treated for that structural variation. I still have pain. I am either told there's nothing else I can do for me, or I'm given pain medication. If that's you, you shouldn't be surprised. You have one alternative. The answer is to get the Yass method so you can get the right diagnosis. If it is muscular, very easy. A few targeted progressive resistance exercises. Your symptoms will be resolved quickly and effectively, and you will be empowered to be able to control this for yourself. If you want more information, you can contact me at Dr. Mitch at mitchellyass.com, DRMITCH at MITCHELLYASS.com. See my Facebook page, Dr. Mitchell Yass, or my YouTube page for great content. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye.